We are almost 5 minutes in, so let's go ahead and get started. And it looks like we have one guest, Tiffany Foy. So we'll go ahead and do our land acknowledgement. Linda, you volunteered for that, correct?
We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregon. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thank you, Linda. Meeting practices, for those of you, almost everybody here is aware of them, but for our guests, and just to remind everybody, we do our best to use plain language, avoid acronyms, just make sure that people are understanding what we're saying, that we're understanding each other, and that everybody participates who would like to participate, and that we're active and proactive about inviting folks to participate, CAC members in particular, that everybody feels comfortable sharing, speaking up. You can speak verbally, you can use the chat to write responses and participate that way. And we just want to make everybody feel welcome. With that, we will get into introductions. Kelly, do you want to help run us through? We do, by the way, we have an agreement that to save a little bit of time, we only do introductions for CAC members and guests.
Yeah, so we'll start with our CAC members. We'll start with you, Brad, and then Miranda.
I'm Brad Porterfield. I'm the CAC chair, also consumer representative and executive director of Latino Community Association.
Good afternoon, everyone. My name is Miranda Hill, and I represent Klamath County, and I'm here at the Klamath County Health Department.
Stacy, then Tom.
Hi, my name is Stacy Shaw. I'm a regional overdose prevention coordinator at the Crook County Health Department, also a community representative.
Hi, Tom Kuhn. I represent Deschutes County Public Health.
And then Mandy and Linda.
Hi, everyone. Mandy Seeley. I use she, they pronouns. I'm in Sisters, and I am a consumer rep.
Linda Johnson. I'm a health council representative and CAC member.
Great. That is all our CAC members for today. And then besides all of our usual players with Dustin, Kristen, Tanya, and Carolyn, we have one guest here today. That's Tiffany Foy. Tiffany, could you introduce yourself?
Hi, I'm Tiffany Foy. I'm with Capital Dental Care. Thank you for letting me be on the meeting.
Welcome, Tiffany. All right. I just want to draw everyone's attention to the fact that we did agree, not everybody, but the majority of CAC members agreed that we would stay with each other an extra half an hour today. So that is the plan, to be together until 2 o'clock. So please keep that in mind. If you have to leave, obviously you're free to leave when you need to leave. But I just want to remind everyone of that. Now it's time for either a patient story or public comment. Anyone have a patient experience, a consumer experience to share, or any comments to make in general about the work we're doing?
I have something I can add for a patient story that happened yesterday, just for something I thought was interesting. my kid's dad went in to have a minor procedure done, and he was told, no credit cards, no debit cards, leave your wallet at home, don't bring anything besides like your ID and your insurance card, your HP card. And then he got there, they're reading from a script and asked him for $200 after telling him not to bring any of his payment or cards. And to my knowledge, I don't think it would have cost him $200, but he just thought that was really interesting, and he was a little worried at first, and he's already pretty worried going into this procedure. So I just thought I would share that. Yeah, he's on OHP.
You say he's on OHP? Yeah.
Will you let me know if he gets any kind of bill?
They told him that they were going to bill him like 2 weeks out or something like that. I was like, no. But he
No.
yeah, he was just like, okay, they told me not to bring anything but my ID, and then asked me for money, and then said, never mind, we'll bill you later. So it just was.
Let me know if you want to follow up and share more about where this happened and stuff like that, and we can talk through it a little more.
Thanks, Kristen and Stacy, for sharing.
I have a really quick public comment. The Warm Springs Skate Park grand opening will take place Wednesday, March 29th. I know that's not a super far way out, but I wanted to put it on everyone's radar. And as soon as we have more information about times and things like that, I can share with the Health Council to share out with this group. But there'll be food, skateboard, shirts, helmets, pads to give away, and a blessing grand opening. And we'll have, you know, sidewalk chalk, bubbles, games, things like that for the families and kids to do. And yeah, so hopefully it'll be warmer and a well-attended event. It's Wednesday, March 29th. And I'll send along information and how to get there and things like that too.
Thanks, Kristen. Is there any other public comment? I will jump in. We have at the Latino Community Association, we're putting together a letter, advocacy letter to send on to our elected representatives here in the state of Oregon, letting them know how important we believe the expansion of Healthier Oregon is to include all Oregonians. And it is in the governor's budget, but that doesn't mean much. Legislators have to allocate that money for this purpose. And so, and I have talked to Carmen, our Health Council director, about the board supporting it. And we just need to kind of move the process forward, because as we go into, they'll be making those decisions in like May, maybe June, as far as how the money gets spent and what's prioritized. But all these things take time to go past committees and boards. And so we don't really have a place in our agenda for the Community Advisory Council, us to consider, have a discussion and talk about whether or not we support that. But I want to put it on the table, put it out there, and get feedback briefly, either from staff on process or CAC members, in terms of how you feel about that. And I guess what I'm really asking for is CAC support, and then the CAC to then ask for the board's support, the board to take an advocacy role, which may be sending a letter, maybe making calls, whatever that looks like. The board would have to decide. And again, this is to expand Healthier Oregon, OHP, to cover all Oregonians. And the missing group of folks in our state are undocumented adults between 26 and 54.
Brad, is there information that we can send out to CAC members?
Yeah, we can get the letter. The letter's being finalized. We're kind of restructuring it to have some bullet points, so it's not so much text. It's not so texty, blocky. So once we get that final, we can send it to the CAC members. Yeah.
Okay. I also just threw a couple of links from the OHA website around Healthier Oregon and then the bill itself in the chat. So folks are welcome to dive in there too.
Thank you, Gwen.
Brad, what's the timeline for this?
Like I said, I think May is my understanding of when they'll be making most of these decisions. It's kind of hard to know when exactly the timing of each bill. And I haven't looked recently to see what the timing of this particular bill is, but I think it's related. My understanding is it's related to both the bill and just the governor's overall budget priorities.
Okay.
So those are kind of two different things because it already passed last year. It's part of the same bill, so I'm not actually sure what this 3352 is, Gwen, but I'll look at it. We can all look at it offline, but it was actually passed as part of Cover All People, but the legislature didn't have the money or didn't prioritize allocating all the money to cover everyone. The first year they chose to cover a segment in the first year and then look at the second year. Now, the plan is to expand, but there's no guarantees. So we just want to make sure we're voicing how important it is to our communities. So that'll be the next step. We'll get the letter to you, Michaela, and
okay.
To get out to the CAC. Any other announcements? Gwen.
I have one from Health Council staff. It's regarding that the Health Council it has enhanced the Operations Council. It's an existing structure that we've had. And one of the things that the Health Council partners have recognized as we've entered into the new year is the recognized need to improve region-wide cross-sectorial collaboration. And so the Operations Council is being rededicated to continue that work or be a space to do that work. So their focus is just an FYI is to support broad initiatives that cross the strategic plan of the organization and the regional health improvement plan and related issues that impact the broader region and multiple sectors. So it's a new journey. We've on an individual organizational level, we've broached collaboration across, within a work groups and within fields and across some sectors. And this is the next chapter of that as people are looking to do broader collaborative work across sectors in a new way. And so it'll be exciting growth and opportunity for all of us to take this to a different level.
And who here is involved in the Operations Council? Do we have CAC? There's no CAC members that are part of that, are there? Or are there?
We're still evolving the partnership right now because it's looking at the operations. We're looking at organizational leaders that have decision making within the organization to be able to shift how the organization is working to help meet the need. We've just started, so we're evolving. How do we engage our other community partners included? So we have included some folks from this audience in that invitation, and we're working on timing and meeting planning. So it's still in the early stages.
Okay.
Can I jump in with a little fun fact about
Go for it.
Hi. Hi everyone, Elaine. So 11 years ago when I started at Mosaic, the Operations Council of the Health Council had just started like the year before. I got assigned to be the Mosaic representative on the Operations Council, my new role. and I went to it. It was all clinicians. And they announced at one of the first meetings, hey, we are going to be starting a community advisory council. We want an operations representative to the CAC. Who would like to be a volunteer? And I said, community, I'm there. I'll be the representative from the operations council to the CAC. So then I came over to CAC and we found someone else for the operations council at Mosaic, and I've been here ever since.
All right.
It sounds like you're trying to get it less clinical operations, so it's more inclusive, which sounds wonderful, a wonderful evolution.
Yep, we're looking at that. Yes, that broader arena, region-wide, systems level, those kinds of things. So, and community voice is very important in that. So
great.
Thanks. Elaine, why don't you go ahead and introduce yourself, and then I want to invite Myra and Connor to introduce yourselves.
Elaine Schultz, and updated name, Mosaic Community Health. I'm the Director of Strategy and Development, CAC community member, she, her, hers.
Thanks, Elaine. Myra?
Hi, everybody. I am Myra Benitez with the CAC as a consumer rep, and I work for Family Resource Center as a program coordinator.
Thanks, Myra. Connor?
Hey, everyone. Connor Carlson. I am a consumer rep here in Bend.
All right. Thanks, everybody. Good participation today. Again, thank you.
I have an announcement before we move on.
Go ahead, Michaela.
Or more of a reminder. So I sent an email yesterday. I'm wanting to form a subcommittee to really focus on the community health projects process and taking some of that more meaty work outside of the CAC to develop this kind of high level process for this next grant cycle, as well as considering some of the challenges that you all expressed during last month. And so this group would work on this next new process and then bring that process back to the group for approval before we move forward on anything. And I put in a link to the doodle poll to schedule this subgroup meeting. If you are interested, please click on that doodle poll by next Tuesday and fill it out with your availability.
Perfect. Thanks, Michaela. All right. Well, let's move on to approving the notes from our February meeting. Does anybody have any, see anything in the notes that needs to be changed or edited to accurately reflect what happened? So we're doing the silences. Whoops. Jones, what can you open? Just look at the chat, sorry. Silence means essentially that we don't see any problems. Let's look at those action items. Is that the only one there?
And I'm still working on the CAC successes, and I'm actually should connect with Michaela and Gwen, as I saw that, to remind me to make if there's anything before I started in this role, because I was thinking like they had sent a letter about OHP hold times at one point. I don't know how far back you want to go, but there's some historical successes that I am just not as familiar with.
How long have you been with us, Kristen?
Oh gosh, 3 years now.
Okay.
So if we just want to go back 3 years, then I can manage that.
Yeah, we have some of the successes on this successes sheet, but we can look at more.
But yeah, your 3 years is plenty for you to help us with, I would say, and then the staff can help with anything else.
Yeah, and I think we captured the wait time on here.
Fantastic. Okay, so February notes, meeting notes are approved. And let's move into our breakouts.
Okay, so today we have more of a discussion rather than an icebreaker. Today's topic of discussion is the CAC's purpose and role in the community. So we have 3 questions here for you to discuss as a group. So how would you explain the CAC's purpose? What is the role of CAC in community engagement? And who would you share information about the CAC with or invite to join? So there's about 3 people in each breakout room, and you can focus on one of the questions or all 3. We'll have about 10 minutes in your small groups. And if you could please have somebody take notes and report back when we're done. Are there any questions before I send you all to your groups? All right, if there's no questions, I will send you all off.
So who wants to start?
I'll go first. Oh, go ahead.
Okay, so I'll go first. And my team was Brad and, oh, I can't remember, Miranda. We were together and we were talking about how, you know, it's kind of more of an elevator speech as to what the purpose of the CAC is, which is to be able to provide and better the health to our community, which is in Central Oregon, and how we can do that. What can we do to provide better quality of health? And the other thing was, who would we be able, and to be their advocates, right? The other thing was, who would we share this information to? Would be other community members that maybe have a leadership role in our communities that could definitely help us, and we would benefit from that. And who would we invite would be more consumers, so we can get their input as to how they feel about the services that are being rendered and how can we provide better quality of care. I don't know, did I leave anything else out, Brad? Oh, and I did, I just remembered. We were talking about, it would be a really great idea to have maybe like a hotline available. So that way people can call in and leave a message and be transcribed. And that way Pacific Source and as the CAC can be able to see those messages or those comments. Okay, I think that was it this time.
Well done, Mara. Well done. Thank you. Mandy, I think you're going to go next. Yeah.
Okay. So for the CAC's purpose, we had to help support the increase of health outcomes in the region. As CAC members bring concerns to the Health Council to improve services, to be the voice of the people, the Health Council is trying to serve in a thoughtful manner to avoid negative impacts. For the role of the CAC in community engagement, supporting organizations who are requesting funds that we give out. There was a little confusion as to the CAC's role in community engagement, as staff usually fills that role. What would you like our role to be? What would be helpful to OHA and Pacific Source? And we didn't get to the 3rd question.
Nice job.
And I was with Connor and Linda.
Thanks, Mandy. And Connor and Linda. Do we have a 3rd group? Staff Miguel, yes, they were working on 3 questions about it. Do we have a 3rd group of CAC members?
Dustin was with us. It was Kristen, Dustin, myself, the guest, I can't remember her name off the top of my head. And then Tanya. And is Kelly trying to talk, or is she talking to someone else while she's on mute?
It looks like she's
okay.
Yeah, she'll be right
back. We tried to remember what the questions were. The one question that we did remember that we did discuss was the purpose of the CAC, and Dustin actually spoke to that.
Hi there, this is Dustin. Yeah, we were the support staff. So I figured as an OHA representative, I should probably know what the role of the CAC is. at least from a regulatory or like a contract perspective. So really my take is that the CAC acts as an advisory group to the CCO to ensure that they're really providing the appropriate care and solutions and benefits to the community that they're representative of. Also to really sign off on a community health assessment and a community health improvement plan. Those are two documents that they're really kind of in charge of and really have the power to assist in making sure that those things are I guess, reflective of the community. And then also to help spend some money for like community benefit initiatives and that might help further the initiatives that are important in that community health improvement plan, as well as just some other things that are important in the community. So I think that was one of the views that we talked about. And everyone agreed. No one has ever disagreed with them.
There's always room for that, Dustin.
Always.
Nicely done. Yeah, that sounded much more official role of the CAC. Thank you for that. Did we have another group?
Our group was the public health people. It was Stacy, Lane, and I. We just right away noticed that, like, wow, we have the 3 public health people in this group. And we answered the first question similarly, and then just got off on a tangent about public health for the rest of the conversation and how we fit in within CAC, because as we like to point out, that public health is not just seeing clients and direct service. There's also population health and prevention, which sometimes people forget about. So that's kind of where our conversation went.
Oops. Thanks, Tom, and the public health folks. All right. Well, thanks everybody. Hopefully those notes got onto staff. Somebody recorded those.
Brad, just a thought.
Yeah.
That I'm wondering, with this upcoming recertification discussion and the need to contact a lot of people on a wide basis, if there's a role for CAC that could be innovative and different, whether it's production of PSAs or maybe a small group, just even ask the question of Pacific Source and OHA, what can our CAC do to help get the word out so that that process can be meeting its objectives?
Linda, I actually had a conversation with Janice and Trisha this morning, and Pacific Source is going full speed ahead on the redetermination process around this. Oh, there's Trisha. Hi, Trisha. We just saw each other. And, how do we weave in all these spaces? But they are moving full speed ahead, and hopefully, we can have toolkits that can be utilized in the space. Since we'll have a backpack for raw, but we'll have a toolkit, right, Trisha?
Yeah, absolutely. If it's helpful to lean in just for a moment, the 2 most important things that we can share right now in absence of having any materials in our hand is, 1, if you talk to a member, encourage them to be sure that their address is up to date at OHA. There's 2 ways that can be done. Okay, actually, there's 3 ways that can be done. 1, they can call OHA directly and make that update. 2, they can call the CCO, so they can call Pacific Source directly to make that update. Dustin, I mean this with the utmost respect, but I will share, of those 2 processes, we measure our wait time in seconds. So I'm just suggesting it might, well done, Kristen, customer service drops in there. The 3rd way to do this is to go to the One site and update it there, that the member can go directly on and make that update. So there are 3 different ways. That's extremely important as the first step to be sure that all communications reach our members. Second most important part there is to encourage the member to respond when something is asked. So often it will just be to verify enrollment, that it doesn't necessarily have to be a scary thing. I'm going to lose my coverage. The bulk of our Medicaid members will remain covered going forward. Something like 1.5 or 1.6 million Medicaid members right now. We're estimating about 300,000 of those members will no longer be eligible at the end of this 14-month cycle. So again, the bulk of members will be, but when something comes in the mail, we need to respond to that in a timely manner. In the absence of responses, people will be unenrolled. It will take a long time, but that will be the ultimate answer. So 2 most important things you can do right now. I will ensure that we get the FAQ that's currently being developed to this group so that you can share that out as a beginner step in the in the toolkit, excuse me. And then happy at subsequent meetings, either myself or Kristen can provide additional updates.
And Tricia, do you have, is that one of the pieces of information that's going out to members just with exactly what you just said? Just really simple, those, how to make sure your contact information is up to date and respond?
We're sharing that with members as they call us. The hardest part is this is a month-by-month process over 14 months. So, you know, we don't know who starting April 1st is being contacted, but we are sharing those 2 information bits with anyone who will listen. So I have meetings with 5 of our largest provider partners to have individual conversations about this in Central Oregon. I'm doing this at the board of directors, at the finance committee, in different work groups with the health council as well. So the hope is that we are reaching our members as this is occurring. You know, it's not to ideally have your address updated. It's just more critical than ever, especially since members may have moved 2, 3, 4 times over the duration of, you know, when we were not redetermining. So, yeah.
Okay. Thanks for that.
This is something I'll just add really quickly that it's a incredibly complicated algorithm that they've used to try and figure out who's getting what first. To even look at it, it's really confusing, and I used to like math, but it is, and it is, and it really means that while there might be this broad group that starts in that first month, anyone that might just have, say, SNAP benefits or something else, like was on a different program, they might bypass that completely. So it's really hard to give you a concrete list of individuals. And the other thing to note is that from first notification, we're requiring people to be contacted in 2 ways, 2 independent ways. So that could be a call and a mailing, that they have 150 days from that notification before they would fall off. And that's 60 days longer than what it used to be. So that's really giving some grace there too. So just wanted to throw that information in there too. And as soon as I get those algorithms and get some idea of how we can share that information that makes sense, I'll be sure to share that with you all too.
Yeah, and if it's helpful, so the CCO is being notified of those members as they're receiving notice, and we will also be reaching out to those individual members as we get notified. So in that 150-day window before coverage gets dropped, OHA will be the first point of contact, and then they're doing some sort of data file dump back to the CCO on what members that month were contacted who need action. And again, that will not be the members necessarily that are just the automatic pass through that don't need any information filled out. So, and then the CCO will be reaching out to those members individually as well across all of our 4 CCOs. So we're really trying to be mindful in this approach, but it is complicated, and it's really going to take all of us leaning into this space.
All righty, thanks for that information. We need to move on, but before we move on, we have, I'd like to invite Elizabeth to introduce yourself, and then who else did I see? Go for it, Elizabeth. Who else did I see? So somebody else. Elizabeth, you want to introduce yourself? Can you hear me?
She's been having some technical difficulties, so I'm not sure.
Okay, we have a guest, Laura Hart. Would you like to introduce yourself?
Yeah, hi, thanks so much. My name is Laura, and I am one of the public health management analysts from Deschutes County, and I'm working with Whitney and Miguel on the RA and the RIP, and so I was just invited here today to listen in on the presentation that's going to be given. Thanks so much for having me.
Welcome. With that, I'll pass it on to Whitney and Miguel.
Hi, thanks so much. So I'm going to share my screen and press some buttons, as one does when they're running Zoom. Okay. All right. So for those that don't know me, my name is Whitney Schumacher. I use she, her pronouns, and I'm one of the newer staff members with the Central Oregon Health Council. Miguel and Helen and I started about a month apart. So if we haven't met yet, I hope we get to meet in person and see what each other's heights are. Most people think I'm taller than what I seem. Anywho, so what I'm here to do today is to talk with y'all about the regional health assessment. And so there's just going to be two parts to what we talk about today. One is I'm going to talk about what is the RAW? What the heck is the regional health assessment? And then two is where we're going to do more of an activity, because I really don't want to talk at you for 30 minutes, and I know you don't want to be talked at for 30 minutes. So with that being said, let's jump into what is the regional health assessment. So I'm going to share why we need this process, why we need this thing, and then what it is. So first off, we have the regional health assessment as the Central Oregon Health Council, as the CCO, because we are stewards of community investments as the Community Advisory Council and the Central Oregon Health Council and Pacific Source Community Solutions. And all of us here, we're here to improve the lives of all Central Oregonians, and especially those who are most vulnerable, underserved, and or marginalized. And we need to know where to direct those investments in order to meet community need. And so again, we have the RAW because we are in charge of these community investments. The RAW, also known as the Regional Health Assessment. And when we think about what is the Regional Health Assessment, it's a picture of our community. And the picture describes various factors like health factors, social factors, what our built environment looks like, education, economic forces. This is a picture of what a community looks like at a point in time. And so another way to think about the regional health assessment is that it's a collection of information that describes the picture. And there is a guiding framework for what goes into the picture. And so the folks that are in charge of developing the regional health assessment, we don't create it because we feel like it. We don't create it because of various things that sound good. We have to follow this guiding framework. And so you see the different elements on the screen here, where we have to follow something called the MAP framework. It stands for Mobilizing Action Through Planning and Partnerships. And then we also have to follow various requirements. So there's IRS requirements, there's public health accreditation requirements, and then the one that is most relevant to us today in this meeting are the CCO legislative requirements. And one of the requirements within that box is that the CAC is involved by providing feedback along the way as the regional health assessment gets developed. And so this is our first time together for the 2024 regional health assessment, getting underway with the CAC being involved. So the RAW, when we think about the regional health assessment being a picture of our community, this picture, like I said, is a package of information. And this package has three parts. So there's existing data sources think about where we could find existing data, like emergency room visit data, Oregon Student Wellness Survey data, different clinical chart information that we could gather from various health systems. Then we also have a community health survey. That is a survey where we're asking folks to tell us more about their experience in being part of the Central Oregon community as it relates to their health. And then the third part of the package are listening sessions where we can dive in deeper to understanding what folks are saying in the survey. And so our time together today is one of many opportunities to provide feedback throughout the regional health assessment development process. And so you see on here a timeline of how the regional health assessment will come together into a final product. So taking in this slide, along the top, you see the month. And then in between lines, you see those components, those parts of the picture, and when those pieces or parts of the picture will come together. And so this is, again, one of many opportunities for the Community Advisory Council to be involved in the development of the regional health assessment. And as you can see on this slide, if you look towards the right side, January 2024, you see that we have a goal of the regional health assessment being ready by the end of January of 2024. Any questions on that very brief, very high level overview of the regional health assessment? So now that I've talked a bit about the regional health assessment being a picture that describes our community in terms of like health and social factors, I want us to hone in on one of the pieces of the picture, the listening sessions. So what we're going to do is dive into an activity to help focus on the listening sessions part of the regional health assessment. And so as we go into this part of our time together today, I want you to think of the various hats that you wear. So think about who you are outside of your job. What's happening with your family, with your friends, and with your community. And so I want you to be utilizing that as we go into this activity. Okay. So sorry, I think I sound like I should be singing jazz in a basement. And so if I sound a little hoarse, my apologies. I might cough a little along the way. So together, we're going to be answering this question: who should we listen to for the listening sessions with the regional health assessment? And so this is going to be a multi-part activity. So the first thing we're going to do is do an individual brainstorm. And then we're going to move into a small group activity. And then we're going to come back together as a larger group. So for our individual brainstorm and thinking, how are we going to answer this question of who should we listen to for the regional health assessment listening sessions? I want us to think about some context and some criteria. So when we think about the context, what I want to share with you is that for the regional health assessment, so far, we have the ability to do 20 listening sessions. And in those listening sessions, there will be about 8 to 10 people in each of those groups. And they're going to be questions and discussions based on community strengths, community gaps, health strengths, and health challenges. And then when we think about how to define groups of people, I want you to think of some criteria. And so that could be things like demographics. So folks' age, the language that they speak, the race and ethnicity with which they identify, maybe sexual orientation, income level, disability status. You could also think about where they live. Other things could be social factors, so where someone lives or their health status or health topics. So for example, people that live with type 1 diabetes. We could think of employment status. We could also think of type of employment, maybe full-time tradesmen, maybe part-time childcare workers. We could also be thinking about community organizations. Is there an existing organization somewhere in Central Oregon that works with a defined group of people? And so I want you to be thinking about this slide when you're brainstorming individual groups on who we should listen to for listening sessions. So what I'm going to do now is I'm going to give you 3 minutes where you can get a paper, pencil, or type on a virtual sticky note on your computer desktop and think about as many groups as you can for who should we listen to for our listening sessions. So I'm going to put a timer up on my end, and I'm also going to give you some thinking music. So if you hear some music all of a sudden coming out of the screen, that's why. Any
Whitney,
questions? Yes.
I was going to ask for that. I was wondering if folks had any questions. If we could pause for questions.
Sorry, this is Brad. In the interest of time, just because we're already running out of time, and I apologize. I'm just curious, the next step, is there any way we could remove a step by just having people do this exact exercise in the chat? Or is there a reason to have that be more private, or
Yes.
process that not to save time? That's what I'm asking.
Yes. So we have folks do an individual brainstorm because all of our brains work in different ways and how we process information. And so what I could do is give us, I could give us 90 seconds to brainstorm groups of people. How does that sound, Brad?
Yeah, let's just go for it.
Okay, so 90 seconds. Go ahead, folks. Okay, time flies when you're brainstorming. So hold on to that list, because now what we're going to do is transition into some small group work. So this small group discussion portion of the program is broken into 3 parts. So first, when you go into breakout rooms, you're going to be asked to share individual ideas with your group. And then what you're going to do after you share your individual ideas is, as a group, you're going to create 6 group ideas based on what you all brainstormed individually. And then once you have 6 group ideas, the third step is where you're going to then select 3 of those group ideas that you would like to elevate to the larger group. And don't worry, you're going to have a staff member in your breakout room the entire time to help guide you through this process. So when you're sent into your breakout rooms, you're going to get a workspace and a staff member, and it's going to look something like this. And the staff member will remind you of the steps, and your instructions will also be on the slide, and they will do all of the typing and the moving of elements on the slide for you. So you can focus on just participating and not trying to run all of the tech behind the scenes. So y'all will be in 3 different groups. One group will be with Michaela, one group will be with Gwen, and the third group will be with Miguel Angel. Before Kelly sends y'all into your breakout room, does anybody have any questions? Okay, so you are going to get, you're going to get 12 minutes as a group to really dive in deep to this question so that you can help determine which groups around Central Oregon should be engaged with for listening sessions for the 2024 Regional Health Assessment. So with that, I'm going to ask Kelly to send folks off into their workspace. All right, welcome back, everyone. Quick check with group 1, Michaela's group. Did you have a third one you needed to move?
Yes, but we were at a conversation with the tie of the young families, seniors living alone, and tribes.
Okay. Knowing what I have from other groups, I'm going to move young families because that's a different one than what I've seen from other activities. So I'm going to move that one, but I won't get rid of anybody's brainstorm. So I'm going to share my screen so we can see what y'all came up with. Okay, so who should we listen to for listening sessions with the regional health assessment? We have this grouping that y'all came up with. College students, traditional, non-traditional, folks that identify as LGBTQIA, restaurants and entertainment staff, service providers, folks that serve the houseless, schools, counseling on aging, young families under the median income, folks that are unhoused, LCA services in every county, Spanish-speaking consumers, mom school services, healthcare, and Better Together has several Spanish-speaking groups of moms. Okay, so what I'm going to be doing from here is sharing the results back with our regional health assessment core development team. And we're going to be taking this along with the results from the regional health assessment steering committee and refining and moving forward this to identify the groups. And then I'll be reporting back to you all. And so all that to say is I'll be back. And any questions, thoughts, or concerns before I hand it off?
Wendy, this is Linda Johnson. I have concerns that even though it was my top choice and when we got into the prioritization, it didn't make it to the list. I'm concerned that our previous regional health assessment really did not address the age demographic of seniors other than around food insecurity. And it's a growing demographic of our population. People move here to retire to be active, and then at some point they're not. And so when we're looking at a regional healthcare needs assessment, if we leave that population out of the group that's interviewed, I don't think we'll be serving our community well.
Thank you, Linda. I appreciate you sharing that. And what I can share is that it was a major theme from the Regional Health Assessment Steering Committee, and that one was surfaced several times. And so I think the beauty of us doing this kind of activity with multiple groups is we surface multiple perspectives. And I appreciate you sharing that with me.
Thank you.
Yeah. Okay, y'all. Well, I recognize that you have a packed agenda, and so I look forward to visiting y'all again to talk about the regional health assessment. And with that, Brad, I will walk away from sharing my screen.
Thanks, Whitney and Miguel. Yeah, we are quickly running up against the clock. So I just want to check in with Gwen and our Pacific Source and OHA folks to see who thinks they can shave time, either bump your agenda item to the next meeting, or if you think you can actually do it in less time, you're welcome to.
So my behind the scenes proposal for the emerging issues update is that we could break that into 2 items. I know that NEMT has an abundance of information that's worthy of some valuable time. And I know that the periodontal dental services, Brad, you brought up a question that you wanted to pose to the CAC around further advancing that. So we could break that up into 2 and perhaps bring NEMT back next month with some more dedicated time, get this question answered or some consensus, or I'd figure out where folks are with your question, and then we could move on to the other items.
That sounds good to me.
Okay.
Yeah, addressing the any non-emergency medical transportation this month. Okay. And then our OHA, AFP, Pacific Source, Martha and Carolyn, do you think you can do your presentations in less time, or would you prefer to have us give you your full time next month? Just real quick.
I think I can get it done in less time.
Okay. Okay.
I was actually just going to put it in the chat, but you're more than welcome to put me over next month.
Okay.
That's completely.
All right. Thanks, Carolyn. So let's move ahead with our plan with Gwen and Martha and see where we end up. Thanks. Go for Gwen.
All right. So y'all have been working, we've all been working with the periodontal dental services. The CAC members brought it up. We've done a number of work around it, including meeting with the DCOs, sending some letters to OHA. It was recent, another consideration that Brad, you shared with us during planning that you wanted to bring forward to the CAC to consider was partnering, inviting the board to partner on on advancing the issues as a broader organizational effort. And so that's the question. Some of the background to that is last month we learned about some of the advocacy avenues that we can take as a health council, as a part of the health council. We learned that this is new and uncharted territory or lightly charted territory for all of our community partners, including you all, staff and organizations. So we're learning this together and exploring what it looks like. And so with that, I think the question is there any interest in having a broader conversation, inviting the board into a conversation of how the Health Council as an entity could support the emerging issue of periodontal and dental services that CAC has surfaced. Brad, do you want to add to it?
I guess just briefly to maybe, yeah, just briefly. So one thought is just moving forward. Like so, if we're advisory to the board of directors of the Health Council, the Community Advisory Council is advisory to the board of directors, and we have raised issues and we've decided it's important enough to advocate, then it seems to be a logical next step is to ask our board to advise the board to advocate for the same issues that the CAC has raised. So that's kind of and we never really took that step. So it seems logical. What that looks like is another question. Like, does the board take it on and work it and use their influence, or does the board then work with the CAC? So the process, what follows is a question mark, but I just wanted to check in with all of you to just about that kind of logical, our advisory role, and so that our advocacy efforts don't stay isolated, that they move on to the board. The board uses the board's influence to also push those issues forward.
Brad, I hear a couple of questions in that, and so I'm just going to spew them out, and they may be totally off base, but one question would be a question of the board about, are we in alignment on the issue of what improvements are needed in dental? And the answer to that would lead us in a different direction. Another question that I'm hearing is that comes from a basis of the board isn't currently engaged in a specific type of advocacy today. Would the request from CAC then be, what kind of advocacy is the board supportive of in general, and are they willing to be a part of? Which is different from the issue, but more about what advocacy activities do we want to be supportive of. And there may be a lot of other questions that are sort of embedded, and I'm just not clear what we're asking of the board.
Well, I'll jump in and then I want to open it up for others to comment. But so my thinking is, if we're advisory to the board and the CAC represents consumer voice, and we've raised issues that are important to consumers, the board needs to know that. And it seems logical to me for us to ask the board to advise the board that this is an issue that needs to be addressed. Then the board decides how they choose to address it. But it's not so much requesting. We're giving advice. We're advising based on our membership. Our consumers have raised an issue. It's important. We've done a bunch of work to meet with the heads of the dental care associations and so forth. And, staff's done a bunch of research, Pacific Source has done a bunch of research, and, take that forward to the board and say, how can you help?
I hear what you're saying, Brad, and also Linda. And because this is new territory, I think we're kind of, putting the wings on as we fly, right? And so I'm wondering, I know for me, I'm not close enough in hearing what the specific issue is. I know a lot of times the issue can be brought up is so broad that the specific ask is not focused enough to say, we need to work on this, whatever that this is. And some of it may be advocacy avenues. Some of it may be operational issues. I know that there's been, Michaela and I were working with Advantage on a specific issue with one specific client. And is that an operational issue for that one specific moment? Or is it something that we need to elevate because this is something that's happening across the spectrum for services? I would love to hear what that recommendation is or the advice to the board. And has that been framed? I don't know what it is. I haven't, is it 1, 2, 3? Is it one general ask or not ask, but issue?
I'd invite anybody else to jump in as well, but for now I will to move us along. But we did draft, and staff helped us draft letters that do address specific issues, like raising the reimbursement rate so that we can have more, providers participating. They can afford to actually serve our OHP clients. Was one. I think workforce diversity was another. Anybody jump in? But yeah, we identified some specific issues, and those weren't even necessarily around the periodontal, but they're certainly related. Does anybody else want to jump in there? Yeah, so those were the ways we chose to, I guess, be advocates and send written testimony. So thanks, Miranda. See ya. However, on the periodontal thing, that's kind of related but different. But those are two, key issues those are broad.
I wonder if we could
go ahead, Michaela.
Up the work that the CAC has already done to share out with you all to see if you do want to elevate it and kind of really define what those specific items were.
Yeah, so one possibility is to formalize, and I've talked to some of you about this, but to formalize, like give a formal presentation to the board. Essentially highlighting these issues that the CAC has raised, and then ask the board, this is what the CAC has expressed as important. We've done some work on it. We feel like maybe the board can do something about it. What does the board think? What do you think about that?
Stacy, Mandy, Connor, and Myra, you all were here, through the course of this conversation as the CAC has been kind of, as we've evolved the emerging issues and looking at dental and periodontal. I'm super curious to just hear from you, just initial thoughts. It doesn't need to be a decision, just what comes to mind when we think about this with Brad's question.
Unfortunately, my child was talking to me, so I missed the question. What was the question again?
Sorry, I thought you were going to say Gwen. Mandy, it's to move, since we are advisory to the board of directors of the Health Council, the idea of moving forward, essentially delivering our advice to the board of directors and asking them how they can help. which is the periodontal, all the issues that have been raised by the CAC that we've made advancements on enough to have an essentially advice or a request of the board.
Is the question whether we support that idea?
Yeah.
Yeah, absolutely.
Connor, looks like you have your mic off.
Yeah, I've agreed with everything you've said so far, Brad. I don't see anything. I don't have any difference of opinion.
Okay. Thank you. Gwen?
All right. Well, then I think what we'll probably do is just have some follow-up conversation around what this might look like and work with a board to figure out what they need to be able to have that conversation as well. So we'll go forward with partnership and an invitation. So, all right, I'm going to hand it back. I think we had just a minute. We were going to hand it back to you, Brad, with the rest of the agenda.
Okay, and we do have a joint meeting coming up, right, in May with the board, CAC and the board. So that might be the opportunity, and that way we could involve all CAC members. That would be ideal.
Well, this is exciting. Thank you for the work. This is what is supposed to be happening. So we look forward to seeing what that looks like.
Good, thank you. All right, Martha, please. Go forward.
Yeah, thank you. Hi, everybody. And thank you for having me here today. My name is Martha Edwards, and I'm the Health Equity Liaison for Central Oregon and the Columbia Gorge here at Pacific Source. I previously presented back in December on behalf of Mosaic, so some of you may remember me from that. I now work at Pacific Source, and I've been here almost 2 months, so I ask for patience as I catch up on the work. And if I stumble through this, I apologize too. This is my first presentation. So Bess is here joining me today in case there are questions I don't know the answer to yet, or if there's anything else that she can chime in that I might forget. So I will let Bess introduce herself very quickly.
Hi, everyone. Good afternoon. I'm Beth Jamie, the Social Determinants of Health and Equity Program Manager at Pacific Source, and have the pleasure of working alongside Martha. My role crosses all of our 4 CCO regions, so I just am a backup dancer for today to help support and answer questions that Martha may not have an answer to. So great to be here.
Thank you. And if we could go to the next slide. So what is health equity? Before we start to dig into projects that go into our health equity plan, I'd like for us to first get on the same page about what health equity is. This slide shows the difference between equality, or everyone having the exact same boost or opportunity, and equity, where everyone has the right opportunity that they need to achieve their best health. OHA recognizes that providing equitable opportunities for every individual is a journey, so they've made it their goal to eliminate health inequities by 2023.
By 2030, Martha.
Oh, sorry.
Yeah, that's okay.
2030, I wrote that wrong. So next slide, please. So the Health Equity Plan is a community-informed plan, and it's a 5-year plan that was developed from community listening sessions in 2019 and 2020. And every year we send the OHA updates. The foundation of our plan is built on the National CLAS standards, which are a set of standards to guide healthcare organizations in developing practices that center health equity and eliminating healthcare disparities. Thank you. So this slide shows the 2022 Health Equity Plan focus areas. As you can see, we have projects that are both internally facing to improve our work as the CCO and externally facing to improve the health of our members and communities. And I will highlight a few projects from these 3 focus areas today. Next slide, please. So we wanted to start by sharing some accomplishments from last year, and we've highlighted a few projects that were directly influenced by feedback and input we received from members and community partners. We offered training for traditional health workers to support members in filing complaints and appeals. And we created a way for community members to submit feedback anonymously. And as you can see here, we have a snippet from our website as to how members can do that. We understand that submitting a complaint can be very scary for some of our members, and we want to ensure that that barrier isn't there. Next slide, please. Thank you. Again, this work was influenced by what we heard from community members in Central Oregon. If you were a part of the CAC a couple of years ago, you may recall reviewing the Where to Go for Care flyer and the non-emergent medical transportation flyer. We updated and improved those documents based directly from your feedback. Other health equity plan projects influenced by community feedback include creating a video in plain language such as Spanish and American Sign Language to explain how to file a complaint or appeal with us. And we created member materials in Farsi, Dari, and Pashto to serve our new Afghani arrivals to the state. And we updated contact information to include we accept all relay calls to better serve members who are deaf or hard of hearing. The way that we receive community engagement and feedback year-round are through the CACs, health equity coalitions, and culturally specific community partners. They've helped shape our health equity plan projects the last couple of years. So heading into 2023, we have 2 new focus areas that we will be working on. Our priority populations include people with disabilities and people who identify as LGBTQIA2S+. And for some of you who are unfamiliar with that term, that stands for lesbian, gay, bisexual, transgender, queer, and/or questioning, intersex, asexual, two-spirit plus. That is a mouthful. And we are also focusing on community engagement activities. Our goal with people with disabilities and the LGBTQIA2 Spirit Plus communities is to provide systems and processes that provide effective, equitable, understandable, and respectful care and services to people with disabilities, people who identify as transgender, non-binary, or gender diverse, and people with sexual orientation diversity, or those who do not identify as straight or heterosexual. Looking at this goal, has anyone heard any stories or have anything to share about the current state of care these populations in this region?
I have a trans friend who no longer lives in Central Oregon because of the lack of healthcare for them. I don't know specifics or anything, but they moved to Portland so that they could get better healthcare access.
Yeah, that is disheartening. That is so sad to hear. Yeah, thank you for sharing that. Okay, we can go on to the next slide.
Hey, Martha, really quickly, can I just ask a quick follow-up question to that? I'm taking notes. I'm just curious if is it the lack of healthcare in terms of providers who really understand what the needs are of a trans person, or the gender affirming care is lacking? I just want to, I'm just curious, sort of, what about the lack of healthcare, sort of specifically, if you know, presented such a challenge?
I think it was a mixture of things. I think it was knowledgeable folks that know how to serve people who identify as such. This is also a Black friend of mine, and so they also felt that they were not treated in an equitable manner. Yeah, and it's been a few years since they told me that, but I could ask.
Great. Yeah, I appreciate that insight. And yeah, any further information you would want to gather on that, we would love to hear it. You know, we're really trying to support the expansion of our gender affirming care across all of our regions, and to make sure that folks that are trans or gender diverse have the access to the care that they need. And certainly if there's a layer of racial tension or marginalization in addition to their identity as a trans person, we would certainly want to understand that better too. So appreciate that, Mandy.
Yeah, thank you. And thank you, Bess, for asking questions. So I think we're on slide 10. So as I mentioned, Pacific Source shows up in our CCO communities in many ways that weren't captured in the health equity plan. We have people like our dedicated health council board staff, our CCO director and community health coordinator who are here, Trisha and Kristen. We also have traditional health worker and health equity liaisons working directly with community members and groups to respond to emergent issues or needs, and using what we hear and learn to inform our work every day. However, we know that there is more that we can be doing. So the CCO team is involved in community meetings. We work with partners where we can share information on concerns and celebrate wins as well. In the past, we have also held community listening sessions, and we hear from the Health Equity Coalition. We also present at the CACs and gather feedback from you all, as well as from other community partners. This has served as our primary way of collecting feedback. But are there any other opportunities that you do not see us engaged in that we can become more involved in? I'll read the questions first, and then I'll leave it open for comments or feedback. Secondly, I know that we all know that you continue to support and develop your own health equity efforts, and how can my team be of better support? And lastly, with the new population priorities, are there any health equity concerns you know about that you would like to share about these new priority populations? And I will leave the floor open for any comments, feedback, suggestions.
So I'll jump in, and I know you know Mosaic well, but I've always thought, I remember seeing in other states how both Medicaid and community health centers have partnered to do like dinners for patients, to do feedback forums, so dinner and childcare provided. So I think, for example, if you wanted to do that in Spanish, and we sent out a notice to all our Spanish-speaking patients, say in Bend or something, I think there's ways to capture more group conversation, and it really helps to have food and childcare. And I know we often rely on LCA to do that, but Martha, you know, anything we can do to help that conversation.
Yeah, thank you, Elaine. And I'm making notes. Anybody else have anything that they'd like to share?
Hey, Martha, I just want to
Go ahead.
Put it out there one more time. That I think we should consider a hotline for consumers to express things toward that's not a formal. Thanks, Stacy. Not as formal as grievances and appeals. So to have kind of two options, a formal grievances and appeals process and a less formal hotline. And maybe we don't even, there can be transcribed, so people don't actually have to be answering the phone necessarily. So maybe we don't call it a hotline, whatever we want to call it. But so that we can all see, what's going on out there. It's just another way for consumers to get information to us individually. And because it's hard to bring groups together. It takes a lot of effort. It takes a lot of time. A lot of people just can't show up on the day and time we choose. There's so many reasons why people don't show up to the kind of focus group efforts. Those are also valuable, but I think we need to find a way to like disperse the opportunity of giving input. And that's the only thing I can think of, somehow, either through phones, texting, through, the things that people are utilizing all the time, make it easy, and then just collect that information and kind of categorize it and see what's rising to the top as things that need to be resolved and things that are working well.
Yeah, thank you, Brad. And I see your comments, and I will make a note. I know we're running behind on time, so Bess, is there anything that you would like to add that I may have missed or anything else?
No, great job. And Martha and I will put our emails in the chat. So if you think of anything or want to follow up with us directly, you're welcome to, and just appreciate being here.
Yeah, thank you. And so I apologize for the mistake so early on.
Thanks, Martha, and good luck in your new role. Welcome. Well, that does give us time for Carolyn, if you would like. You have 10 minutes.
I
Talk
can
about the marketplace. Okay.
I closed out my thing really quick. Let me pull it back up. Did I send you guys the slides? Actually, now that I'm thinking about it, I don't recall.
No, there was no slides, but you had
okay,
those informational flyers.
Okay, I knew that I sent something. I've been sending so many people so many things.
You're welcome to share your screen though.
Fantastic, thank you. Let me get this pulled back up right quick. Okay. All right, can you see it?
Yes.
Thank you. So again, I'm Caroline Black. I'm with the Oregon Health Insurance Marketplace, and I serve Central Oregon and the Gorge. But I'm here today because the unwinding is coming up, right? That's a really big topic. And I'm not here so much to speak on the marketplace's position with the unwinding. I'm really here to talk about the benefits of the marketplace, so that information can be shared out wherever the conversations may come up. So a lot of people still don't know who we are, and we've been around for a very long time, but we are a part of the state government. We're with OHA, and we are not our own platform-based marketplace because we don't have our own system. So we do use healthcare.gov for the eligibility and determination processes for that financial assistance that's available through the marketplace. And we have our program team who oversees our programs and functions, as well as the outreach team, which is what I'm a part of. And we go out and educate and inform the public and other community organizations and groups such as yourselves. We do that mostly in person on a normal time, but we do all the way around the state. We each have our own region. I cover Central Oregon and the Gorge, as well as in Benton counties over on the coast or over in the valley. And there's, I think, five others that have different regions throughout the state. We make sure that all of the plans that are available on the marketplace are certified and meet the requirements set forth in the Affordable Care Act. We provide assistance with enrollment. We support insurance agents and community partners who also provide the assistance. And we go out and we do our outreach and education about health coverage and financial assistance. All kinds of different things. And the things that we do aren't even necessarily health related. We go to all kinds of events. I'm in Bend all the time. The events over there are fantastic. We have our call center. It is open Monday through Friday, 8 to 5, and we take calls and answer questions through there. We educate and certify other community groups that provide that free local help. So all of the OHP application assisters also have some level of marketplace training requirements that they have to meet in order to be fully certified. Even if they don't assist with marketplace applications, they do have that knowledge base to make those qualified referrals. We also provide some funding to those community groups and insurance agents to provide that additional marketplace level assistance. And we refer people out to other community groups and insurance agents and other services that they may be needing information that we may have, such as SNAP or other services available through the Oregon Health Authority or other state agencies as well, depending on what their need is. We also advocate on behalf of the Oregonian consumers who face problems or they're experiencing hurdles and barriers at the federal level with healthcare.gov. There's a couple of us that actually advocate for them and make those phone calls and do what we can to help them resolve issues, because insurance is confusing enough as it is, especially the United States healthcare insurance policies. So if you don't live it, you don't know it. And we're there to help them resolve their issues on the marketplace as well. You're aware of what the coverage options are in Oregon: Medicare, OHP, small group health plans, and individual. Our primary focus is healthcare.gov. And the reason why is because that financial assistance is only available at healthcare.gov, nowhere else. The individual plans really, it's individual because it's not group, is really what that means. We're all aware of the sign up periods with the unwinding, the folks that are being faced with that. There is that unwinding special enrollment period that'll be in place until next July. So for people that are losing their coverage within the April 1 and July 2024 timeframe, this really doesn't necessarily apply to them until open enrollment. Anybody can shop on the marketplace as long as they are not convicted of, if they're not incarcerated and had been convicted. If they live in the United States in a state that uses healthcare.gov, so if they're in Oregon, they're not incarcerated and they're ineligible, they have an eligible immigration status, they can go through the marketplace. Anybody, the only people who cannot utilize the marketplace are those that are convicted of a crime and incarcerated, and people who do not have an eligible immigration status, which in this situation is DACA and undocumented. All other statuses can go to the marketplace. So even those folks that have very little income that aren't eligible for the Healthier Oregon program because they're outside of those age groups, right? They can go through the marketplace, even with zero income. And they can access, they can potentially qualify for the highest level of benefit in that financial assistance to help them lower their costs. And folks that would fall in the higher level of financial assistance available will see plans for as little as $1. And we'll talk about the financial assistance. I have 3 minutes. So we'll talk about the financial assistance as we go through these. That's the income guidelines. We're all aware of those. There is no income limit for financial assistance to be available for someone. It's really based on the percentage of income that they would have to pay towards a premium that calculates that, which is what this is too. You guys don't need to know the details on how it is really, but what it boils down to is depending on household size and income, depends on the expected premium contribution amount. The way the law is written is a family or individual cannot pay more than a certain amount of their income towards a health plan premium. If the health plan premium is more than that specific percentage, then the financial assistance comes in to bridge that gap. That's where the tax credits come in. So if a person is within that 150 to 200%, they can't pay more than 2% of their premium or their income towards a premium. It's against the law. So that's where the tax credits come in. The tax credits can be applied to any plan. Someone that would be within that specific, below 250% actually would qualify for cost sharing reductions, which lowers our out-of-pocket costs. And that would, I think I have a slide. Oh, I don't in this one, but the out-of-pocket costs, like you can see on this one, out-of-pocket cost sharing reduction is only available on a silver plan. So when they apply that to a silver plan and they're viewing them, you can see that the annual deductible is only $750. This specific screenshot is from the Dows. So it is going to be different depending on the area for each individual, their age and household makeup. But ultimately, this is like the big piece right here. If they're eligible for that financial assistance and the cost sharing reduction, even if they're not eligible for Medicaid due to immigration status, they can still go through the marketplace as long as their immigration status is within the time frame and they're not, you know, their documents aren't expired and what have you. But the savings is there, the affordable piece of coverage is there, and that's really what I'm just trying to spread out is there are other options. People don't know that, and there is help available out in Central Oregon that can talk to folks about this that are coming off of OHP and all of those things. So on not only so the co-pays and such also on cost sharing reduction does get reduced, maximum out of pocket, deductibles, all of it for cost sharing. So silver plans are definitely beneficial. And all of our assisters and insurance agents are located on our website. You can just punch in the zip code and select the type of help you're looking for. If marketplace coverage is selected, all of the insurance agents that are certified to navigate marketplace are there, as if they say they want to be listed on our tool, as well as the community partner organizations that are certified to assist with marketplace. If they say, yes, we assist with marketplace as well. And it's the website, and it's just right there. And there's also a really cool locator or a window shopping tool, which is the information I grabbed the plan slides off of, just based on a household report of $40,000. So,
Hey, Carolyn, will you back up just one slide? Well, now 2 slides. That list of who should apply or something like that.
oh yes, absolutely. So this is really for us to come out and do an info session, right? Or when you can refer them to us. If you're even just, you know, talking to your neighbor Bob and he's like, well, I don't know what I'm supposed to do, you know, and just having those conversations, it's really, oh, well, hey, did you know that these people exist and they can help you? And I would be happy to send you the slides too. So
Thanks, Carol. Yeah, go ahead and send them to the staff, to Kelly or Michaela.
I will do.
And with that, we are out of time. People are welcome to go, but if there's somebody who does have a question or comment for Carolyn.
And I also sent my e-business card, which is in the packet too, I believe, with my handouts. But I'm available. So my phone number, email, all of the things, you're welcome to reach out.
All right. Thank you.
Thank you. See you guys next month.
All right. Thanks, everybody.